A 71-year-old retired mechanic sat in a urologist's office in Ohio last year. He had been waking up 8 times every single night for 6 straight years. His old doctor gave him pills. Those pills did almost nothing. They made him dizzy in the morning. They killed his ability to be intimate with his wife. And every 3 months his doctor renewed the prescription without question. Then he moved to a new city and saw a different urologist. That new doctor looked at his chart, paused, and asked one question. "Have you ever been told about a procedure called Rezum?" He had never heard the word, not once, not from his previous doctor, not from any medical professional in 6 years of suffering through 8 bathroom trips a night and a medicine cabinet full of pills. 3 weeks after a 15-minute office procedure, he was sleeping through the night. No pills, no dizziness, no sexual side effects. He called his wife crying from the parking lot of the clinic afterward. This is not an unusual story. Research suggests that more than half of all men over 50 are living with an enlarged prostate right now. After age 70, that number climbs past 80%. That means if you are a man watching this video and you are over 60, there is a very strong chance your prostate is already pressing against your urethra and slowly squeezing your quality of life away. The medical name is benign prostatic hyperplasia. Doctors call it BPH. But there is nothing benign about waking up 5 or 6 times a night and never getting a full cycle of deep restorative sleep. There is nothing benign about standing at a urinal for 90 seconds waiting for a weak stream to begin while other men walk in and out behind you. That is not aging. That is a gland suffocating your urethra. And the part that should concern you most is not the condition itself. It is what your doctor is probably doing about it, because the standard response in most urology offices has not changed in 30 years. Your doctor checks your prostate. He nods. He writes you a prescription for tamsulosin or finasteride. He tells you to come back in 3 months, and he moves on to the next patient in 8 minutes. What he almost never does is sit you down and explain that there are now minimally invasive procedures that can fix the problem in 15 minutes, without putting you on pills for the rest of your life. This video is not medical advice. Vita always recommends that you speak with your doctor before making any health decisions. But what we are about to show you is the science most men are never told about. We are going to explain exactly what is happening inside your prostate as you age. We are going to show you the mechanism that is strangling your urethra from the outside and why pills only mask the pressure. We are going to walk you through 5 procedures that exist right now in clinics across the country that most general practitioners and even some urologists never bring up in a standard appointment with patients. And we are going to explain why the system keeps you on medication instead of offering you a solution. Because once you understand the economics behind prostate treatment, you will never look at your prescription the same way. If you are a man over 50 or you love someone who is, please stay for this entire video. The information here could change the next 20 years of your sleep, your confidence, and your independence. Let us start with what your prostate actually is, because most men have lived their entire lives with this gland inside them, and they could not tell you what it does or where it sits or why it matters. Your prostate is a walnut-shaped gland that wraps around the tube called the urethra, which carries urine from your bladder out of your body. In younger men, the prostate is small and causes no interference at all. But starting around age 40, your prostate begins a second growth phase. Nobody fully understands why. Hormonal shifts play a role. Testosterone converts into a compound called dihydrotestosterone, which tells prostate cells to keep multiplying. As those cells multiply, the gland expands outward. But there is a capsule of tissue surrounding the prostate that prevents it from growing freely. So instead of expanding outward, the gland pushes inward toward the urethra. Picture a garden hose running through a slowly tightening fist. That is what is happening inside your body right now. If you're over 60, the hose is your urethra. The fist is your prostate, and the fist never loosens. The squeeze happens so gradually that most men do not even realize it is occurring. They adjust. They stop drinking water after 6. They plan their day around bathrooms. They accept it as normal aging, but it is not normal aging. It is a mechanical obstruction caused by a growing gland that can be treated, and the fact that millions of men do not know this is not an accident. It is a system failure. Here's the mechanism your doctor probably never explained. Your prostate is not one uniform mass, it has zones. The one causing your problems is called the transition zone, and it surrounds your urethra directly. As BPH develops, the transition zone swells with new tissue. That new tissue is not cancerous, it is not dangerous on its own. But its physical location is catastrophic because it compresses the one tube your bladder depends on. When the urethra narrows, your bladder has to push harder to empty itself. Over time, the bladder wall thickens and becomes muscular in the wrong way. It starts contracting randomly, sending you urgent signals even when it is barely full. This is why you feel the urge constantly. It is not your kidneys producing too much urine. It is your bladder panicking because it has been fighting a narrowing tube for years and its walls have become overactive and irritable. Most doctors respond to this by prescribing alpha blockers. Drugs like tamsulosin relax the smooth muscle around the prostate and bladder neck. They can improve urine flow, but they do not shrink the prostate at all. The gland stays the same size, it keeps growing. And the moment you stop taking the medication, your symptoms come roaring back because the underlying obstruction was never addressed. The drug is a bypass, not a repair. The second class of drugs is called 5-alpha reductase inhibitors. Finasteride is the most common. These actually do shrink the prostate by blocking the conversion of testosterone into dihydrotestosterone over several months of continuous use. But here's what the prescription label does not emphasize. Research suggests that finasteride carries meaningful rates of reduced sexual desire, erectile difficulty, and ejaculation problems. For some men, these effects persist even after stopping the drug, so the standard medical approach is either a drug that does not fix the problem or a drug that shrinks the gland but may permanently compromise your sexual function. And your doctor rarely explains this trade-off honestly. There is a third option that has existed for decades: transurethral resection of the prostate, TURP. Surgeons go in through the urethra and carve away excess tissue. It works, but it is a full surgical procedure requiring anesthesia. TURP carries risks of bleeding, infection, retrograde ejaculation, and in rare cases, incontinence. It requires hospital time and weeks of recovery. For many older men with other health conditions, it is simply not appropriate or necessary. And this is exactly where the system breaks down, because between the pills that mask and the surgery that scares there is a generation of minimally invasive procedures that sit in the gap, and most men never hear about them. These procedures are not experimental. They are not alternative medicine. They are FDA cleared. They are covered by Medicare. They can be performed in a doctor's office in under 30 minutes. And they preserve sexual function. The first is called Rezum. It uses water vapor, which is steam delivered through a small needle into the enlarged prostate tissue. The steam destroys the excess cells. Over weeks, the body absorbs the dead tissue and the prostate shrinks naturally. Rezum takes about 15 minutes. It requires only local anesthesia. Most men go home the same day. Clinical studies show significant improvement in symptoms and urine flow. And in 2026, its clearance was expanded to prostates up to 150 cubic centimeters. The second procedure is called UroLift. Instead of removing or destroying tissue, UroLift uses tiny implants to physically lift and hold the enlarged prostate tissue away from the urethra, like curtain tiebacks pulling fabric to the side. No tissue is cut, no tissue is burned, no tissue is removed. The implants are permanent and the procedure takes less than an hour. Research suggests that men experience rapid symptom relief with low rates of sexual side effects. The third is aquablation. A robotic system uses real-time imaging to map the prostate, and then a high-velocity water jet precisely removes the obstructing tissue. It is particularly effective for larger prostates that other procedures cannot fully address. The fourth is a temporary implant placed inside the prostate for about 7 days. It reshapes the tissue from the inside, then it is removed. No permanent implant stays in the body and the reshaping holds. The fifth is prostate artery embolization. An interventional radiologist threads a tiny catheter through the wrist artery to the prostate and blocks blood flow to the enlarged tissue. Without blood supply, the excess tissue shrinks over months. 5 procedures, all cleared, all available, all with strong evidence. And yet a study of general practice referral patterns found that the majority of men with moderate BPH symptoms are still offered only medication first and surgery as the distant last resort. Nobody sits them down in a chair and says, "Listen, you have options between the pills and the knife." Nobody draws a diagram. Nobody explains that you could walk into a clinic on a Tuesday morning and walk out that afternoon with a smaller prostate. And the reason nobody does this is not because the procedures do not work. It is because the system that delivers prostate care was built decades ago, and it has not been redesigned for what is available now. Your general practitioner writes prescriptions. Your urologist performs TURP. The gap in between belongs to nobody. And in that gap, millions of men are waking up at 3 in the morning, reaching for the bathroom wall in the dark. Let us talk about the numbers. According to published research, roughly 94 million men over 40 worldwide are living with BPH right now. In the United States alone, there were over 4 million physician visits for this condition per year. 50% of men between 51 and 60 already have prostate enlargement. By 70, that number is 80%. By 80, it reaches 90%. If you're a man and you live long enough, your prostate will grow. But here is the statistic that should concern you. Despite the availability of 5 minimally invasive procedures, the vast majority of men with moderate symptoms are still managed exclusively with medication for years before anyone discusses alternatives. That means millions of men are spending 5, 8, 10 years on daily pills that never fix the underlying problem, while procedures that could resolve it in a single afternoon appointment remain undiscussed in the exam room, and the cost to those men is not just measured in pharmacy bills, it is measured in sleep. Research connects chronic nocturia with increased risk of falls, depression, cardiovascular events, and all-cause mortality in older adults. Every time you wake up at night and stumble to the bathroom in the dark, you're exposing yourself to a fall. Every night of broken sleep is eroding your immune function, your memory consolidation, and your emotional stability. One published review found that men with severe nocturia had significantly higher rates of hip fractures compared to men who slept through the night. The prostate is not just pressing on your urethra, it is pressing on your entire quality of life. And the sexual impact is just as devastating. BPH itself can affect sexual function. The medications prescribed for BPH can make it worse. Finasteride alone has documented rates of persistent sexual dysfunction that some researchers call post-finasteride syndrome. Yet, the minimally invasive procedures, specifically Rezum and UroLift, were designed with sexual function preservation as a primary outcome. Clinical data shows that these procedures maintain erectile and ejaculatory function at rates significantly higher than traditional medication or surgery. So why would a doctor keep prescribing a pill that may damage your sexual health when a 15-minute procedure could fix the obstruction and preserve everything that matters to you as a man? That is the question nobody is asking out loud. The answer is complicated, but it is not mysterious. Most general practitioners do not perform these procedures. They are not trained in them. They are not compensated for referring you to them, and the pharmaceutical industry spends enormous amounts ensuring that medication remains the first conversation. Alpha blockers and 5-alpha reductase inhibitors are a recurring revenue stream. A man who starts tamsulosin at 60 may take it every single day for 20 years. That is 7,300 pills generating consistent pharmacy revenue. A man who gets Rezum at 60 has one procedure and walks away. The recurring revenue disappears. The refill disappears. The 3-month follow-up appointment to renew the same prescription disappears, and nobody benefits from that disappearance except the patient. This is not a conspiracy. Your doctor is not malicious. Most physicians genuinely believe they are helping you manage a chronic condition. But the system they operate within rewards management over resolution. It always has. The inversion point is this: the cure exists. It has existed for years. It is sitting in clinics across every major city in the country. And the reason you have never heard of it is not because it does not work. It is because nobody in the chain between your symptoms and your solution has a financial incentive to tell you about it fast. Your GP renews pills. Your pharmacist fills them. Your insurer pays for monthly prescriptions. Everyone gets paid as long as you keep swallowing. The moment you get a 15-minute procedure that fixes the obstruction permanently, the entire revenue cycle collapses. Not because anyone planned it that way, but because the system was never designed to prioritize resolution for conditions it can profit from managing. And men suffer quietly because prostate problems carry a stigma that heart disease and diabetes do not. Men do not talk about weak urine streams at dinner. They do not mention the 8 trips to the bathroom to their friends. They endure it privately and assume there is nothing to be done beyond what their doctor already prescribed. And the doctor does not correct that assumption because within his training and his system, the prescription is the standard of care. But standard of care is not the same as best of care. Standard means what most doctors do. Best means what the evidence supports, and the evidence now clearly supports offering minimally invasive options far earlier than most practices currently do. Published guidelines from urology associations increasingly recommend discussing procedural options with men who have moderate symptoms rather than waiting until symptoms become severe enough to justify traditional surgery. The shift is happening slowly. Younger urologists trained in the last decade are more likely to offer Rezum or UroLift as a first-line discussion. But millions of men are still seeing doctors who graduated before these procedures existed and whose referral habits have not updated. If you're watching this and you have been on prostate medication for more than 2 years without meaningful improvement, you owe it to yourself to ask one direct question at your next appointment. What about a procedure? Do not accept the answer of it is not that bad yet, or let us try another medication first. You have the right to know every option available to you. And your doctor has an obligation to present them, even the ones that do not require a prescription pad. Here's what you can do starting this week. And none of this replaces a conversation with your doctor. Vita always recommends working with a medical professional before making any changes to your health plan. Step 1. Ask your doctor to measure your prostate volume with an ultrasound. A simple number in cubic centimeters tells you and your doctor exactly how enlarged the gland is and which treatment options match your specific anatomy. Step 2. Request a referral to a urologist who specifically performs minimally invasive BPH procedures. Not all urologists offer Rezum or UroLift or aquablation. Ask the referral coordinator directly, does this doctor perform in-office prostate procedures? Step 3. If you are currently taking tamsulosin or finasteride, ask your prescribing doctor this question. What is the long-term plan? Is this medication intended to manage symptoms indefinitely, or is there a procedural pathway that could resolve the underlying obstruction? If the answer is just keep taking it, that is the signal to seek a second opinion. Not because your doctor is wrong, but because you deserve to hear all the options from someone trained in the full spectrum of available treatments. Step 4. Reduce your sitting time. Research suggests that prolonged sitting compresses the pelvic floor and may worsen prostate symptoms. Stand every hour. Walk for 10 minutes. Give your pelvic region consistent relief from sustained pressure. Step 5. Limit caffeine and alcohol after 4 in the afternoon. Both are bladder irritants that amplify urgency and frequency. You cannot control your prostate size with diet alone, but you can reduce the signals that make your bladder panic at night. Step 6. Practice double voiding. When you urinate, wait 30 seconds after you finish and then try again. This technique helps your bladder empty more completely and can reduce the number of nighttime trips by training your bladder to release what remains. Step 7. Ask about pelvic floor exercises. Kegel exercises are not only for women. Strengthening the pelvic floor muscles can improve urinary control and reduce the urgency that BPH creates. Your doctor or a physical therapist can teach you the correct technique. Step 8. Check your other medications. Some cold medicines, decongestants, and antihistamines contain ingredients that tighten the bladder neck and make BPH symptoms dramatically worse. Ask your pharmacist to review everything you take over the counter. Step 9. Track your symptoms for 2 weeks before your appointment. Write down how many times you urinate during the day. Write down how many times you wake up at night. Write down whether the stream is weak or interrupted. Bring that log to your doctor. It transforms the conversation from "how are you feeling," which is vague, to "here are my documented symptoms," which is actionable. Data changes prescriptions. Feelings do not. Give your doctor data to work with. Step 10. If you're over 60, ask about a PSA test. Prostate-specific antigen testing is not perfect, and it does not diagnose cancer on its own. But a baseline PSA combined with prostate volume gives your doctor a more complete picture of gland health. And here is the most important thing to understand. BPH is not prostate cancer. They are completely different conditions. An enlarged prostate does not increase your risk of developing prostate cancer. This is one of the most common medical misconceptions among men, but the fear of cancer is exactly what keeps many men from seeking help. They avoid the doctor because they are terrified of what he might find. And in avoiding the appointment, they miss the chance to fix a treatable mechanical problem. Your prostate is not your enemy. It is a gland doing what hormones tell it to do. The problem is not the gland itself. The problem is that the medical system around it has been too slow to adopt the solutions that modern science has already built. And here is your permission to stop blaming yourself. If you have been suffering in silence for years, it is not because you ignored the problem. It is because the system failed to give you the full picture. No one told you that a 15-minute steam treatment could have fixed this 2 years ago. No one showed you a diagram of your prostate pressing on your urethra. No one explained that the pills were a bridge, not a destination. You did what your doctor told you to do. You took the pills. You adjusted your life. You stopped drinking water at night. You memorized every bathroom in every building you visit regularly. You did everything right within the information you were given. The information was incomplete. That is not your fault. But now you know. And what you do with this knowledge in the next 30 days could determine whether you spend the next decade waking up at 3 in the morning or sleeping through until sunrise. Talk to your doctor. Ask the hard question. Ask for the referral. Ask for the ultrasound. Ask for the procedure name. Write it down. Take this video with you if it helps. Show it to your doctor and say, "I want to know about these options." You're not being difficult by asking. You're being responsible, and any doctor who respects your health will respect the question. If they dismiss it, seek another opinion. Your sleep, your confidence, and your dignity are worth a second conversation. If you are a woman watching this and you recognize these symptoms in your husband or your father or your brother, please share this video with him. Men do not talk about this, but someone has to start the conversation. And it might as well be you. The cure is not hidden. It is not experimental. It is not expensive. It is sitting in a clinic probably within 30 minutes of your home. The only thing missing is someone telling you it exists. Consider yourself told. Now here is the warning. If you do nothing, your prostate will keep growing. It does not stop. It does not reverse on its own. The squeeze on your urethra will tighten year after year after year until something breaks down. Untreated BPH can lead to acute urinary retention. That means your bladder fills completely and you physically cannot urinate. It is a medical emergency. It requires a catheter inserted through the urethra to drain the bladder immediately. Research suggests that the risk of acute retention increases over tenfold between men in their 40s and men in their 70s. This is not a distant possibility. For men with untreated moderate to severe BPH, it is a statistical likelihood. Chronic urinary retention can also damage your kidneys. When the bladder cannot empty properly, urine backs up through the ureters toward the kidneys, creating pressure that over time can cause permanent kidney damage. Recurrent urinary tract infections are another complication. When urine sits in the bladder too long, because it cannot fully empty, bacteria multiply. Older men with recurrent UTIs often do not realize the root cause is an enlarged prostate blocking complete drainage. Bladder stones can form in the stagnant residual urine. These stones cause pain, blood in the urine, and further obstruction, all of it preventable, all of it traceable back to a gland that was growing unchecked while pills mask the symptoms. And the sleep deprivation alone has consequences that most men underestimate. Chronic nocturia is associated with higher rates of depression, cognitive decline, cardiovascular events, and accidental falls in adults over 65. Every night of interrupted sleep is a night your brain did not complete its repair cycle. Every stumble to the bathroom in the dark is a fall risk multiplied by drowsiness. Your prostate is not just a urinary problem, it is a safety problem. The men who suffer most are the ones who wait the longest. They wait because they are embarrassed. They wait because they think it is normal. They wait because their doctor said come back in 3 months, and they believe that meant everything was under control. Everything was not under control. Everything was being managed. And management is not the same as treatment. Management means you keep paying and keep adjusting and keep losing sleep while the gland keeps growing inside you unchanged. Treatment means someone addresses the obstruction. Treatment means the urethra opens. Treatment means you sleep. Treatment means you stop scanning every building for the nearest restroom before you even say hello. You deserve treatment, not just management. And the technology to deliver it exists today in offices, not operating rooms, in procedures measured in minutes, not hours, with recoveries counted in days, not weeks. Do not let embarrassment cost you another year of broken sleep. Do not let the word prostate make you change the subject. It is a gland. It has a problem. The problem has a fix. Speak up. If your doctor does not know about Rezum, ask for a referral to one who does. If your doctor dismisses the question, find another doctor. You're not being difficult. You're being a man who refuses to suffer through something that no longer requires suffering. The medical landscape is shifting. Younger urologists are trained in these procedures. Insurance coverage is expanding. Medicare now covers Rezum and UroLift and aquablation for eligible patients. The barriers are falling. The only barrier left is silence. Break it. Tell your wife, tell your brother, tell your golf partner, tell the man sitting next to you at the barber. Because if he is over 60, there is an 80% chance he is dealing with the same problem and he has never said a word. Prostate health is not a private shame. It is a public health conversation that has been whispered for too long. Millions of men are awake right now at 2 in the morning standing in a dark bathroom when they could be sleeping. They could be sleeping because the fix exists. It is cleared, it is covered, it is available, and someone just needs to say the words out loud so they know where to look and what to ask and who to call tomorrow morning. That is what Vita is here to do, not to prescribe, not to diagnose, but to hand you the information your system was too slow to deliver and trust you to walk into your next appointment knowing more than you did before. If you are experiencing any of the symptoms discussed in this video, please consult your doctor or a board-certified urologist. This video is for educational purposes only and does not replace professional medical advice, diagnosis, or treatment. If this video helped you understand what is happening inside your body right now, hit subscribe and turn on notifications. Vita is here every week breaking down the health science that matters most after 50. Share this video with one man who needs to hear it. You know who he is. He is the one who always knows where the bathroom is. He is the one who stopped going on road trips. He is the one who never complains, but you can see it in his eyes. Send him this link. Tell him to watch it. Tell him to ask the question at his next appointment. It could change the next decade of his life, and it starts with one conversation he has been too afraid to have. Your prostate does not have to control your life. Your sleep does not have to end at 2 in the morning. And your doctor does not get to decide what you know, you decide. Now you know. I will see you in the next one.